Hey everybody, it's Matt Shu from Upright Health, and today I wanted to talk with you about tight muscles. We get a lot of emails, a lot of comments from people about feeling tight in certain parts of their body. We want to address this because there's this very common misconception about tightness, and that's if you feel tight, you need to massage it and you need to stretch it. So let's say, for example, your hamstrings, right? You feel like, oh, my hamstrings are super tight. I need to stretch them. I need to smash them and make them stop being so tight. The thing I'd like you to think about is that tightness does not always mean that something needs to be stretched and smashed. It doesn't mean that something is shortened always. It can. So there's a couple different ways of thinking of the situation. If we're focused only on the muscle that feels tight, the tightness can reflect a couple things. It can reflect the muscle actually being strong and short, meaning like you overused it a lot and you've like, let's say with the biceps, you just did a bunch of bicep curls, you did a whole bunch of rows, you did a lot of exercise with the biceps, and they're just like, tight. You wake up the next morning, you can barely straighten out your elbow because the muscle here is so tight, or feels so tight. It's short, it's strong, it's creating a situation at the joint that it crosses, and that's giving you this sensation of tightness. Okay, so strong and short. You could also have a situation where the muscle is weak. And it could be weak and long, or it could be weak and short. So thinking about hamstrings, that's pretty much the classic example. So your hamstrings, if they're weak, they could be in a it could be in a lengthened position. So when we talk about anterior pelvic tilt, you could have anterior tilt, and your hamstrings are actually in a lengthened position, and they're too weak to even pull the pelvis back down. Okay, so that's not really a great situation. That can feel tight. Your hamstrings could also be weak and short. So if you're in a posterior pelvic tilt and you had shortened hamstrings, so like that would be classically somebody who sits in a slouch kind of like this all the time. You have some shortened hamstrings, right? It's kind of a posterior tilt. Hamstrings are just sort of like, not really strong. You've kind of trained them to do absolutely nothing, but they're also in a shortened position, and they complain to you with that same sensation of tightness. So we have these three situations: strong, short. We have weak, short, and weak, long. Those situations all are different, right? Even though they feel the same. Tightness can just feels like tightness, but it's super misleading. So when you're in the situation where it's strong, short, that's the classic situation that we think of when you got to stretch, smash, and that will help. Like if my biceps are like, oh God, it's too tight, it's too tight, and I've been doing all these curls or whatever, then I need to start opening this up, maybe do some stretches out here, get these muscles to relax. But if something is weak and short or weak and long, I can stretch and smash those things all I want, and they're not going to change. They're going to maybe temporarily feel a little bit better, and then once that tightness comes back, I know that this is just not working, right? So this is something that people comment on some of our stretching videos, where they say, well, oh, you know what? I've done this stretch for weeks and weeks and months, and it doesn't change anything. This just doesn't make sense, right? And it's true. Like it doesn't make sense to keep doing the same thing that doesn't work. So in that case, you need to think, well, how can I change the approach to this? If you have something that's weak and long and you keep stretching it and massaging it and smashing it, it's not going to get better because it's weak. It has to get stronger, and you need to train it to go back to its normal position. So if you think, or a more ideal position, if you think of that hamstring situation where something is weak and long and you're in that anterior pelvic tilt position, things that you need to think about to address that include strengthening the hamstrings so that they can help put the pelvis in the right place, and also looking at what other muscles are related to that positioning that's throwing things off, right? Maybe it's not really the hamstring's fault per se. Maybe it's other muscles that are pulling the pelvis into a certain position the hamstrings are unable to overcome, and then you have this weak hamstring, long hamstring situation. That's why in the fixed anterior pelvic tilt program, we talk about different muscles. One of the things is like your quads, right? If your quads are super strong, if they're strong and short and they're pulling you into anterior tilt, and your hamstrings are long and weak, your hamstrings are going to feel tight, right? They can feel super tight, even though they themselves are not actually the thing that needs to be stretched and smashed. It's actually up on the other side. So you can't just make decisions based on the fact that something feels tight. You have to make your decisions in terms of training based on the way your body moves, the way it feels, and the way it responds to what you're doing to it, right? So again, if you're stretching and massaging something over and over and over again, and it's not getting any better, then that's not the approach that's going to work. You need to then change your tactics. Maybe you need to strengthen it. Maybe you need to strengthen something else. Maybe you need to stretch something else. Maybe you need to massage something else. So if you're dealing with something a muscle that's super tight, you're dealing with something that just doesn't seem to go away, don't think about tightness as short, strong all the time. It doesn't mean stretch, smash all the time. And that's why we've talked about, strength matters. Like Josh and I have done a bunch of videos where we talked about strength being important to think about. If you've already done a whole bunch of stretching, if you've already had massages all the time, you have to look at it from a different angle and get things to move in a better way globally, instead of just thinking about what feels tight. So this has come up a lot recently, so hopefully this video helps you conceptualize this a little bit better, and I hope you remember that pain sucks, life shouldn't.